my name is Dr Ibrahim Abd Elrahman. I'm a consultant gynecologist here at King's College Hospital. Been a consultant for 16 years and I've got over 30 years experience in obstetrics and gynecology. Today we're going to talk about uterine fibroids. Fibroids are known as leiomyomas or myomas, and they're basically benign tumors of the smooth muscle of the uterus, mainly composed of fibrous tissue. They grow quietly, very, very common, very widespread. A lot of ladies might have small fibroids and not even know they're there. Fibroids arise spontaneously. There's no obvious cause for it, but if you've had a fibroid before, you're more likely to get other fibroids. Genetics plays a very important role in this. They're very common in the Middle East, Far East, Sub-Saharan Africa, and South America. They're also related to estrogen. So the higher the estrogen stimulation, the larger the fibroids will get. Fibroids, as I said, they're very common. They're present in a lot of ladies after the age of 30 and many, many more after the age of 40. And if they're 1 or 2 centimeters and not causing any issue related to the menstrual cycle or to giving pain, then nobody's going to know anything about them and they're not going to go specifically looking for them. So in those cases, the fibroid is diagnosed as an incidental finding when somebody has an ultrasound. If fibroids are big and causing symptoms, then the lady will present to a gynecologist or a family medicine doctor, and then they will have a scan, and that will show whether or not there are any fibroids. The risk of fibroids becoming malignant is very low. It's very, very low. One of the things we should do before we do any surgery for fibroids is do specific blood tests and carry out ideally an MRI scan to assess the fibroids as thoroughly as possible to assess for any risk of cancer. Although I really do stress, the risk of fibroids being malignant is incredibly low. Fibroids can be treated in many ways. The first is to give just simple medication to control the bleeding or control the symptoms. So you can have simple medication which is non-hormonal, which simply reduces the bleeding and the pain with every period. You take that for 1 or 2 days every month and that's it. You can consider something like progesterone medication or a normal contraceptive pill to again lighten the periods and control the bleeding. There was a medication called 𝐔𝐭𝐞𝐫𝐢𝐧𝐞, which was well known and very good at reducing the size of the fibroids. It's still licensed for use. Not so much here because it's only licensed for one course, 1 3-month course, because we know it can have detrimental effects on the liver. So we don't really like to use that. The next is something called uterine artery embolization, where we put a tube in through the blood supply in the thigh, feed it around to the blood supply of each fibroid and block it off. So the fibroid dies from inside and shrinks to about half its size. There's usually an 80% satisfaction rate with that. The other option, which is not widespread here, but much more available in Europe, is something called HIFU, which is high intensity focused ultrasound. They use an ultrasound machine which is set below the MRI machine and focused onto each fibroid, and it's used to try and disintegrate the fibroid and shrink it down as well. The next option is to have what's called a laparoscopic myomectomy, which is what most gynecologists will be doing, where you put a telescope in through the belly button, identify the fibroids on each aspect of the uterus, open the wall of the uterus, remove the fibroids, and repair the uterus where you've removed the fibroid. You can have many fibroids removed in this way. It's not limited to a number of fibroids. It can be limited to the size of the fibroid, because if you leave the fibroids for very long, it may get to a point where it's not safe to do it laparoscopically, and then you need to have an open procedure to remove it. Having mentioned the HIFU and the embolization, both of those are not recommended for someone who has not had children, because we know it can affect the blood supply of the uterus. But we do know a lot of people have managed to have babies after these treatments, so it's not an absolute contraindication. If all these conservative treatments for the fibroids are not successful, the final treatment can be a hysterectomy, which can be done either keyhole or open, where you remove the uterus and the fibroids together. For a laparoscopic myomectomy, you usually have 3 or 4 cuts in the tummy. The 2 of them are about this big, size of 1 knuckle, and 2 are about half that size. You have 1 cut in the belly button, where we put a telescope in to see what's going on, And then in a line halfway between the belly button and the bone on the pubis, you have 3 cuts or 2 cuts, depending on how many fibroids are on, what procedure is going to be carried out. We'll put a couple of instruments in, and while looking at a screen, we open the wall of the uterus, remove the fibroid, and then suture and repair that part of the uterus that we've opened. Having done all of that, we ensure the uterus is stable and it's absolutely fine. Then we use what's called a morcellator, which is usually put in through the middle opening in the halfway between the bone and the umbilicus. That morcellator has a blade that spins around, and we basically grab the fibroids and take them out in little strips. That way you don't need any big open cuts in your stomach. Recovery following a laparoscopic myomectomy should be 2 weeks. So after 2 weeks, you can go to the gym, you can do anything you want. Risks with the procedure, like with any surgical procedure, infection, bleeding, damage to the vessels in that area, so the bowel, the bladder. But these are all low risks, and we have to advise you about them by law. The final thing you need to accept if you're going to go ahead with this surgery is the need that you will have to deliver by cesarean section, because wherever we remove the fibroid, that is a weak point on the uterus, and you really don't want to strain that weak point with a few hours of labor.